starts putting on a lot of weight and forming this waxy film, the vernix on them. Okay, so there's a couple things about this. I call it nature's lube. It helps with the birthing process. But it also, if she couldn't tell you how far along in her gestation, and we see vernix, what do we know?
Getting ready for delivery.
Right, it's full term, it's ready to come out. If we don't see vernix, be afraid, okay? So vernix is a good thing. So it's gonna help with the birthing process. Another thing I wanna talk about vernix is when the babies come out, years ago, they cleaned the babies all squeaky clean and handed you a clean baby. Well, I can tell you from personal experience, I'm at home now putting baby lotion and oil on this baby because the skin's dry, cracked, and having problems. What they found is we've been intervening too much. Leave the vernix on and actually encourage mom to rub it into the skin. It's a natural lubricant to help that transition from a water world to an air world. Also, it has an insulation value to it. So if you leave it on, it helps maintain baby's body temperature. So vernix is good stuff, so leave it on there. All right, get in there.
Drowning.
So, Chuck's pads. So when we're setting up, open up your OB kit, but if you have Chuck's pads, newspapers, towels, whatever you can get, put 3 layers in front of her. So we're gonna have 3 layers. The reason for this, when the baby's coming through the birth canal, there's a bladder and a colon right there too. So as baby comes through, it might push out some fecal material, some urine, or whatever else. So we might have some soilage. So what I'm getting at is, if anything comes out ahead of baby, all you have to do is peel a layer off and have a clean working surface. It's much easier to peel a layer off than to stack on top of soiled. Okay? You have this set up. We're gonna have someone set up as the baby catcher. Baby catcher is going to get their hospital towel, and this is your catcher's mitt. Okay? So your job is, especially if this is number 5 or 6, what do we know is going to happen? It's going to be fast. It's called an incipient birth, and this baby may just come shooting on out. So your job as a catcher is put your hand here at the vaginal opening, and your job is when the baby starts to come out to help guide it out nice and smooth and slow. Not to stop it, but just don't let it come shooting out. So you're going to be the catcher's mitt. We're going to have an equipment manager off to the side. You don't want to be in splash zone, so have everything set up to the side. So the contents of our OB kit, these are the towels they give you to dry the baby. If you've been to the dentist recently, you recognize it? Okay. You know what happens, they get too wet, they disintegrate. A good use for these is just to set out and put your equipment on them, because it gives you a nice clean working surface. So I can just lay that out with my equipment. So this is the one Chuck's pad that comes with the OB kit, so go ahead and utilize that if you have some extras. Okay, the bag we're putting the placenta in right here, so tuck that aside. 1 bulb syringe, a scalpel. What do we do with this? Get rid of it. Make it go away. We are going to pull out bandage scissors for trauma shears. Clean them with alcohol prep, let it air dry, and we're going to use that to cut the cord. The cords are like real fibers, like a garden hose. We don't want to be hacking with that scalpel. It's much easier just to do that with that. So use these. Okay, now there's OB towelette and alcohol prep. They've gotten much better at making it so you can tell the difference. So the OB towelettes, so in other words, if she has any anything you need to clean up, fecal matter or whatnot, we need to clean her before the baby comes out, use the OB towelette, not the alcohol prep. She'll kill you. All right, so there's some sponges, and we're going to use these, so we can go ahead and open one of these. And so as the baby's head presents and comes out, have her stop pushing, small panting breath, That way she'll kind of hold off. We're just gonna wipe the baby's nose and mouth with a 4x4, as long as the amniotic fluid was clear to a straw color. If we're suspecting meconium, we're gonna use our bulb syringe. As soon as the head presents, have her stop pushing, wipe the face, but we'll suction the mouth and then each nostril with that. All right. So we got a couple sponges. Have that out. Have a bag there. What am I missing? It's a complete kit. I'm missing 2 umbilical clips. Must be in another kit. So I'll have 2 umbilical clamps set aside. And again, we're not going to be using this for at least 5 minutes after the baby's born. So I'll have the 2 clamps. I'll have a bunch of those with you for the Saturday. Okay. That's basically all we use, 4x4s, OB towelettes, the bulb syringe, and the